Good morning, everyone. I'm going to get us started here. I am Shannon Wagner, and I am the Regional Resource Specialist Team Supervisor. And I just want to welcome everybody to the August DSD Quarterly update. Everyone has been muted to reduce potential background noise today. We encourage you to use the Call Me option because this helps with your audio connection. To ask a question, please use the Q&A panel on the right of your screen, and we will address questions as they come. However, if there is no response, we need to take it back for further consultation, we will do that and we'll get back to you later. So this webinar is being recorded, and details will be posted on the training archive page when available. I'm just going to go over our agenda for today. We have a full session of great information for you today, including legislative updates, CADI DI customized living updates, Moving Home Minnesota, DHS announcements, COVID-19 updates, and information about upcoming training sessions and webinars, and the resources that we provide at the end of every webinar. I am going to go ahead and pass back to Charles Young for our legislative update.
Good morning, everybody. Hopefully you can use your emojis, making sure my audio is working okay for everyone. All right, looking good. Well, thanks for having me here, everybody. I typically come by. I am the Legislative Coordinator for Disability Services Division, and we do like to go around and give an update on the legislative session after each session ends. Typically, when I've come to these meetings before, for those of you that have been here in prior years, our legislative update is usually relatively long. PowerPoint is usually 20 to 30 slides. Those of you that have seen the slides already know that I just have 7 for you today, and that is representative of the type of session that we had. So I am going to be presenting both on some updates for our aging division then as well as Disability Services Division. Just really giving some highlights for the aging area. I think if anyone out there has some questions around aging proposals, aging provisions that passed, we would end up deferring to them, but you can just email us and we'll make sure that we get you the right kind of answer. So looking at the next slide, I know many of you out there are probably following along very closely this session. I know we've got many of you out there that have provided feedback on provisions. We're following along, maybe even had your own that your different lead agencies were working on as well. This was supposed to be a policy year for the legislature. In policy years, that means that no budget provisions need to pass for government to continue operating. But again, as many of you were very well aware, there was a very large surplus for the legislature to use this past session. Found out midway through the session that the surplus really amounted to about $9 billion that they were able to potentially use, the legislature was able to use this year. So expectations were high in a lot of areas, and none more so really than Health and Human Services. We saw billions of dollars worth of spending proposals through the session, really kind of drowned out some of the policy talks that they were having at the time. But unfortunately, what we saw was that session did end on May 23rd without agreement by the Minnesota legislature on supplemental budget appropriations for most of the omnibus bills. That included Health and Human Services. There was a bill that did pass, an HHS omnibus. There were some policy provisions. There were a couple of budget provisions in there as well. But for the most part, the majority of the budget provisions that were looked at this past session did not pass. And so really when I'm going to be talking today, I've got a slide for you on what did pass. And our slide on what didn't pass is going to be much longer. And I know many of you were trying to follow those provisions, so I'll try to hit many of those as well. We wrote the middle of this slide a little while ago. There was maybe some hope that there was going to be a special session this year to pass not just the HHS bill, but the legislature and the governor had agreed on tax and spending bills. They were looking at public safety and education bills. But unfortunately, both sides came to an impasse, and both sides acknowledged that the special session was not going to happen this year. As many of you know, this was a very busy year, not just because of the surplus in the legislative session, but it was an election year. It was a redistricting year, and so many legislators found themselves in new districts and had to either decide whether or not they were going to run in the new district, run against potentially someone from their own party, or retire. And so there was a lot of shifting going around with the legislature, which meant this last session became very political in many ways, as many of the years past have been as of late. But at this point, because of the elections, both sides of the legislature and the governor determined that they weren't going to have a special session, most likely at this point. Could still happen, but not very likely with, again, these pending elections coming. So one of the things that we do want to remind everyone, and obviously we're okay because it's now August, but there was some concern that because there wasn't an HHS, Health and Human Service Omnibus bill passed, a spending bill, that there may be a shutdown. But the legislature passes a budget for the entire biennium during a budget year, which was the previous year in 2021. And so the government was fully funded. The only thing that really happened was that the new funds in the surplus weren't fully spent. So as far as we know, those funds will be available in the next session, the upcoming one here in 2023. We will be looking to the November forecast to kind of see what that's going to look like. So at this point, we're not worried about a shutdown of any kind. That did not happen at the fiscal year on July 1st. The government is fully funded now until next June 30th. All right, looking at the next slide, we will talk a little bit about what did pass. So not to go into too many details, but the governor and the House and Senate really didn't come up with budget targets for many of our committees, including Health and Human Services Committee, until about 2 weeks before the end of session. And that turned out to not be enough time for many of the bills for the House and Senate to collaborate on the omnibus bills. But they did work together to pass smaller policy-only bills. Many we're calling them mini-buses rather than omnibuses for HHS and mental health. The Health and Human Service omnibus passed about half an hour with half an hour left of session when bills could still be passed. And then the mental health omnibus passed with about 5 minutes left of session. So they were the last bills considered by the legislature this last year. They did pass. They're now known respectively as Minnesota Laws 2022 Chapter 98. And for the mental health minibus, Minnesota Laws 2022 Chapter 99. For those of you that have the slides, we have linked the bills here too, so you can see them for yourself. So really what we saw here, some of the major changes, there were some I think big wins in some ways. The first one really came out of our aging area, and that was the Vulnerable Adult Act redesign. Many of you may have sat on some of the panels working on the Vulnerable Adult Act redesign, and phase one did pass this past session in the policy bill. Also on the disability services side, our policy and technical cleanup bill was actually one of the very few bills for us that did pass. Many of our technical provisions did pass, and I'm going to cover just a couple of those here. But for the most part, the changes are minimal. Maybe the biggest win that we had was for our EIDBI services. We saw some changes there to conform with changes that they've needed. And we have had several, I think, e-list announcements that have gone out around those, for those of you that are working with people that are receiving EIDBI services. Then we did see revisions to technical language for the customized living rate floor. The legislature did pass provisions that allowed remote adult day as a permanent option. We saw changes, modifications to the HCBS Employee Scholarship Program grants to allow for loan forgiveness. And again, on the aging side, modified definition of palliative care in hospice statutes, revisions to assisted living licensure and AL council membership, And then out of all of the articles that passed, 2 of them actually belong to the MnChoices recodification. So 2 articles were dedicated just to a recod for the MnChoices statute. Recodification really means that there are no substantial changes to policy for MnChoices, but many of the provisions have been reorganized and renumbered. And so what this will result in is hopefully a cleaner read of MnChoices, but many documents referring to different sections of MnChoices, both at the state level and I'm sure at the lead agency level, will have to be revised to reflect those new numberings and the new language there. Just looking, some of the things that we didn't include here that I think have come up with other lead agencies that they wanted to talk through a little bit more that did pass is that, and we're still working with CMS on this, but the legislature was very interested, as many of you were watching and can probably assume, but the workforce shortage was the #1 priority really in Health and Human Services. And they had a number of spending bills that were trying to tackle that. Again, many of those didn't pass. We're going to hit those in a minute. But one of the things that did pass was they looked at increasing the capacity of both ICFDDs, adult foster care, and community residential settings. These are all really meant to be temporary increases. On the ICFDD side, it allows for any ICFDDs with 6 or fewer beds to increase to 7 or 8 beds. And on the adult foster care and community residential setting side, it would allow for a 6th bed variance. We do need to go to CMS to get these approved. We're not quite sure whether or not CMS will look favorably on these, and so not a whole lot of information is out there yet. We are going to have to negotiate with CMS on all of these. If they do move forward, and I know many of you are probably most interested in the CRS license capacity in the adult foster care, the variances only last for a year once CMS approves, so they're very time limited. The idea that the legislature had here was that consolidating some homes, allowing for a larger capacity, meant that we could stretch staff out a little bit farther as the pandemic wanes. So those are a work in progress. Should they move forward, you will, those of you that want to follow along a little bit more, or maybe even submit feedback, these are going to have to be waiver amendments on the waiver side for CRSs. That waiver amendment will have to go out for public comment, as all of our waiver amendments do, and so you'll have a chance to weigh in on your feelings around the 6-bed variance then as well. So again, it's not guaranteed. It's going to be some time before we can get a waiver amendment out there, but something for you to watch for. Maybe one other thing before I talk about what didn't pass is we did see a little bit of cleanup in MnChoices around remote assessments. Again, it was very minimal, but just really trying to call out that the decision on whether to have a remote assessment for MnChoices when it's allowable comes down to the person or the people making decisions, authorized to make decisions for that person then too. So, yes, that was everything that passed. That's everything I've got. Now let's talk about what didn't pass. For those of you following along this session, we called out the bill here that had many of our spending provisions. That was Senate File 4410. That's where most of our provisions were consolidated. And we were looking at potential rate increases for EW and CADI. We saw PCA and CFSS had some large increases there too. DWRS saw their own, nursing facilities, ICFDDs, NEMT. Basically everyone had some sort of rate increase, almost everyone within 4410. So again, there was a lot of optimism there. What we ended up finding out when they negotiated targets was, though, that the legislature and the governor agreed on just $1 billion in spending for Health and Human Services. So that couldn't accommodate for all of the rate increases that both the Senate and the House were looking at. And that's really where the impasse came down to for us. Other things that didn't pass were the initial PACE implementation, expanded access to shared services in HCBS. This was another, some more of the work the legislature was doing to combat the workforce shortage by allowing more services to share staff. Other things that didn't pass was an increased income and spend down limit for older adults and people with disabilities, establishment of a nursing home workforce standards board, and other workforce related provisions such as grant programs for students. The one really big bill that did pass that really started in Health and Human Services, of course, was the the payments to frontline workers, which hopefully many of you have heard of, maybe even applied for. We really hope a lot of our HCBS nursing home staff have applied for then as well. The frontline worker payments started in HHS because it was focusing on really, I think, nursing facilities and hospitals at the beginning, expanded to include PCA, CFSS, and then HCBS. And it was, I think, interesting. The nursing union in particular came out and said that they didn't want to be the sole recipients of these frontline payments, that it was really thanks to grocery workers, child care workers, that many nurses and frontline staff were able to even go to work. Without them, they wouldn't have been able to do it. So as many of you have likely seen, that frontline worker payment really expanded to anyone who was working in person during the pandemic. And for those of you that were following, I think we've had 1 million applicants in Minnesota, and right now the job of the state is to try to figure out how to stretch out those funds, who's going to be receiving those at this point. So that was really, I think, the big effort by the legislature to reward frontline workers during the pandemic, and ended up being really the only thing that was passed in our area meant to address the workforce shortage. So yeah, looking at the next slide. So there were a couple other bills. I already mentioned the frontline worker pay bill that did pass. The application period has closed for that, but those of you that are interested in checking out information on that, we've got some links in here for you. Also, the ALS bill on the aging side, that was signed into law in the session and appropriated $5 million to respite services for caregivers through the MBA. And then the state government omnibus bill did not pass. The Legislative Task Force on Aging bill did not pass out of conference committee, and so that's going to be something that they might take up again next session. Next slide. So, just wanted to leave you with a little bit of what to expect in 2023. Anybody that's been following the legislature really closely knows you never know really what to expect. But 2022, of course, is an election year. The entirety of the legislature, the governor, and therefore the cabinet could change this session. So that's really the big wild card. We don't know what to expect as we go into session until we know who's going to be in the legislature and who our governor will be. Next year is also a budget year, so it's very important that a budget is set. A budget does need to be set prior to July 1 to avoid a shutdown of any area that hasn't been funded for the biennium. And so they're not only going to be looking at the surplus, the hopeful surplus that still remains for them, but they've got to set the entirety of the state budget there then too. Of course, we assume that there's going to be a lot of continued effort on COVID-19 response. It depends on what kind of legislature and governor we have as well when it comes to that. But at this point, we saw a lot of this last year, and so we're assuming this next year we're going to see a lot of one-time funding and grants. ARPA is a good example of some one-time funding. We saw a lot of state grant funding that's passed in the past couple of years then as well. It's one of the ways that the legislature deals with surpluses. If they're not too sure that those funds will continue to be a surplus in the future, they pass one-time funding meant to help in a specific area. So next year is going to be a really big wild card. What I can say on the DSD side, for now, we are working on many of the proposals that didn't pass last year. We've got our policy proposals and we've got budget proposals that we are working on for each of our program areas. It is ultimately up to the commissioner and the governor what bills are going to be pushed out of Disability Services Division and Department of Human Services in general. And so again, we're kind of waiting on the election to see what we'll be working on this next session as well. For those of you that are working on maybe any interest groups or working on some bills with us, there is, just to give you a little bit of an update, at this point in time, we can talk freely about what we're developing at DHS. But at some point, after the commissioner approves all of the proposals that we're going to send to the governor, as soon as we send them to the governor, we enter what's kind of like a cone of silence, which is very frustrating for many stakeholders every year. But as soon as we send those proposals off to the governor, we enter a period where those proposals are no longer ours. the governor, his or her team, are able to change those. They can modify them. They can create their own. They're no longer us, so we don't really know always what's going on. That cone of silence typically happens in December. With the election, it might be January this year too. So we'll see what happens. I think the big takeaway is there's just a whole lot of unknowns at this point as we enter 2023. And with that, I think my last slide here. Just wanted to, again, thank you all. I am so sorry that I did not have more good news to pass on during this presentation, but I am going to stick around. Not sure if there's any questions, but hopefully you can also get a hold of us too through any of your RRSs. If you've got questions, just let us know.
Thank you, Charles. And I don't see any questions at this time. So as a reminder, you can click your Q&A on the bottom of your screen if you'd like to submit any questions for Charles today. Thank you so much. All right, we are going to jump to our next section here covering the CADI BI Customized Living update. And Jan Buck will be our presenter for that. So Jan, the floor is yours.
All right, good morning, everyone. I'm going to give you a caveat. First, two things. One, my computer loves to restart on its own in the middle of meetings when I'm talking. So if that happens, your RRSs will entertain you with other information till I get back. And second, the links in the PowerPoint you're about to see are not live because the new information that went out yesterday in the e-list. And if you're not signed up to receive e-lists, I highly encourage you to do that. That is the best place to receive all the new information the minute it's out. So without further ado, let's move forward. So the e-list that went out yesterday was to release some new documents developed by DHS with input from lead agencies and some customized living providers. But before we get into the new documents, I just want to back up because we've been talking about this all year. And so for those of you that are not understanding how we got where we are and why the changes occurred January 1st, we're just going to go through some slides that many of you have already seen regarding the changes to customized living for the BI. So what changed and what started it was a legislative change in 2021 that put a moratorium on new customized living settings and maximums and limitations on customized living for BI and CADI. So next slide, please. We're going to kind of go through these kind of fast to get to the new information. So in the previous years, we all noticed, you noticed as lead agencies, our legislators noticed, the Blue Ribbon Commission noticed, just the amount of spending that was occurring for customized living services for the CADI and BI waivers. And it was an increase that occurred without, rate increases. So without a change in law that would have led to that and then would have been, of course, understood. But the CADI customized living expenditures grew by 244% between fiscal year 2017 and 2021. And CADI grew on its own by 90% during this period. So the Blue Ribbon Commission, and that link, I believe, is live, but I can also send you the link if you're interested in reading the entire Blue Ribbon Commission report. It's actually pretty interesting. And the legislature were interested in controlling the growth, as were you, lead agencies. Next slide, please. So one policy that passed in the 2021 legislation was a moratorium on any new customized living settings that would serve 4 or fewer people, be delivered in a single family home, or provided through the CADI and BI waivers. And it did not apply to settings that were in business operational before June 30th, 21, or ownership changes at the same address. Yes, I'm sorry. I probably should just say next slide. So, and this happened because of the growing concern over whether customized living services delivered in the settings were really more like CRS, which is exactly what we've seen. And the CRS settings have had a limitation growth since 2009. And we all know that what happened was customized living settings in these small settings started to be used in place of and treated like they were CRSs. So to control that, there was a moratorium on new enrollments. Next slide, please. So for existing settings that met the moratorium criteria, the legislature established time-limited, cost-neutral moratorium to transition eligible people and settings from customized living to CRS settings. And this exception goes through, it started July 1st and it goes through June 30th of next year. Providers will have to get a 245D license, which is different than the MDH license that they hold to provide customized living services. So very early in the year, DHS reached out to providers directly that they thought would meet the criteria. Next slide, please. And they also reached out to lead agency licensing liaisons too. So it's up to the people, of course. So both people receiving the services and the providers need to understand what that change means. And so for providers, it means different licensing requirements. They need to understand that customized living and community residential services are not at all the same services. And of course, as always, our case managers need to ensure that a person has an informed choice about whether they would be interested in the service changing at that setting from customized living to a CRS. And like I said, for providers, it's a different licensing, there's different requirements, and they might not be comfortable. So everybody needs to understand the differences, the limitations in the service they're currently providing, and how it needs to be brought into line with service intent and billing intent versus the opportunity to change to a CRS, and then abide by those licensing standards. Next slide, please. So one of the big thing that happened was the 2021 legislature applied limitations to the rate tool for the BI and the CADI. So when a service agreement renewed or when there was a change that required a change in customized living provider or any new calculation, so pretty much like all DWRS changes, it's a rolling implementation. The policies put limitations in place and they ensured that the hours entered into the rate tool don't exceed 24 hours and that they match the assessed need. And the limitation in the rate tool, obviously, as you all know, prevents you from going over that 24. Next slide, please. I do see that we are getting some questions, so I think I'm gonna hold on those if that's okay. Daniel, I see you have a question, and I think if we can wait, we can do all the questions at the end. That's totally fine. I don't want you to think I'm ignoring you. So one of the limitations is that there's a limit of no more than 24 hours of support. There are 24 hours in a day. And in previous authorizations for the past several years, people were authorizing 70, 80 hours a day in a 4 or 5 bed house when there's one staff on site. So you can understand, considering the intent of the service is direct task-based service, how that would not be possible. Within the 24 hours, there's also maximums based on a person's assessed case mix. Next slide, please. So a case mix, which of course is determined by their assessment, affects how many hours can be entered in certain parts. And so I'm sure most of you have already engaged in this. If you have CADI, BI people that you work with, and you are fully aware since January that the case mixes for the A, D, and G, there's no more than 2 hours per day of mental health, and for ADL case mix B and D, there's no more than 4 or 6 hours per day. Next slide, please. So this is the statute language that, you know, you are free to give to providers. You know, you did not make the statute. We need to adhere to the statute. And this is the language within the statute that clearly calls out the limitations. So next slide, please. I am kind of going fast through these. Most of you have seen these slides, and I just want to kind of bring you all up to speed before we move into the new documents. Again, there's maximum staffing hours, and these are the service categories that are affected by the 24-hour combined number of hours. Now that can't exceed 24 hours per day. So next slide, please. And then this is just a very specific slide where the limitations are that they're in the ADL and the mental health management. That's where your case mixes come into play. Thank you. And the B, again, with the ADLs can't have more than 4 units per day. And the Ds may not have more than 6. And then mental health, again, the AD or G cannot have more than 2 units per day. I'm sure many of you have encountered this. Next slide, please. So, all right. So this is now August. And so what we've learned since January 1st, and I'm sure many of you have learned different things and the same things as this, but we have learned that we have provided technical assistance to specific lead agencies regarding specific cases, sometimes more than once for the same individual. We've met with lead agencies and providers at the same time. And what we've learned is that the providers lack basic key information about the service they're providing. And the actual service intent has never changed. It has been the same the whole time, but what's changed is how it's being used. And we also are aware that lead agencies, are being pressured by hospitals and the correction system, which was a little bit of a surprise to me, to place people in customized living settings that are not appropriate. And of course, you know, to be very, you know, open with you, we all know that's because there's they want them out. They find someplace that's willing to take them. And so they start moving forward. They get the family engaged. They get the person engaged. But it is absolutely not the right setting in many of these situations because of the cares the person needs, the availability of staff, and none of which, you know, the staff availability is not customized living. So we are aware that you are getting caught in the middle of that. We've learned that we all knew this, that the previously over-authorized rates were based upon excessive hours a day, duplication of the task service. So we call that stacking, where you're putting in time for what is essentially the same task, but across several services or within the service in the subservice. And that 100% of the time, the issues are using the service as trying to provide available staff as a billable task. And so that's been a problem. These issues have been pretty much across the board. What we have learned in our specific technical assistance with lead agencies and providers for the last 8 months. So I know we know you're dealing with it. One interesting piece is this is not a statewide issue. This is really limited to a few counties. So it's a lot of work for those of you that are impacted, but luckily this is not a statewide issue. We've heard from several lead agencies that their internal process has prevented this from becoming an issue, which is really good news. So we can focus our energy on the lead agencies that are in need of our assistance. Next slide, please. So we want you to know that we are aware of the difficult conversations you are having. We are having them too. We have met with providers. Our leadership has met with customized living providers. There's been ongoing meetings of our leadership and customized living providers for the bulk of 2022. So those conversations have been happening. We've been working with you. We've been working with providers to try to get everybody going down the same road, and to really have a thorough understanding of the intent of the service. And so we are aware that you are having these conversations. They are very, very time heavy, We're aware of that. We need service authorizations to be adjusted correctly to align with the new limitations, to reflect the service provision, and to be ready for individualized budgeting, where this will really become this will come to light even harder than it is now. So, and of course, as we all know, some providers have been willing to walk the road with us, and some providers have not, and have expressed really, well, I don't even know what word to use, strong opinions about the changes. Next slide, please. So what we're doing, and we're continuing to, of course, provide the case-by-case technical support. There have been 3 of us that, if you've had technical support, that have reached out with you and worked with you, myself, Charla Scullin from the exceptions team, and Kyle Dennis. We've been pretty much the ones that you've been talking to from the DSD area when there's issues that you want addressed specifically. We did publish the changes to the statute before the year started. The ARMIS user manual was updated before the year started, that updated the changes in legislation so users could see that and give that information to providers. And we acted on feedback from you to build more tools to help in the conversations with customized living providers. Next slide, please. All right, now we're going to try something. We're going to have me take over sharing so I can show you the actual tools, and then we'll come back to this PowerPoint. So I am going to share my screen.
1 second.
Can't.
I think. Let me find you. Hold on.
Come on.
Come on. I think I gave you the power.
Yay. All right. And are you seeing the e-list announcement?
Yes, we are.
Yes? Oh, great. Okay. So, again, please, if you are not already signed up to receive e-list announcements, please do so. That is a great way to get notification of things that are changing. And what I'm going to walk you through is a lot of information, and your first thought's going to be, oh my gosh, now you want me to read all of this? And the answer to that is yes, I do. And I want you to hold off on submitting any customized living exceptions until you read through it all. You have your provider read through it and get a better understanding. These tools will really help them, and it'll help you in your conversation. So it's worth the time and energy that it will take. But we already had somebody submit an exception yesterday using the new form, and they needed to be advised that they had to go back and read the information. So please do that. So this is the E-list announcement, and it's pointing out 2 tools, and there's more tools than that, but these are the CBSM tools. So it tells you what we have here. We have a new resource. This used to be called the 6790H, and now it has moved to the CBSM, so it'll be a bit easier to find. But to start our journey, we're going to open up the quick reference guide. And that's the newest, that's kind of your starting point. And I like to say, and this was actually one of our TTC members that was key in designing and releasing these documents, suggested a no wrong door approach. And so because, we at DHS have a hard time finding things as well as you do. So this way, there's really no wrong way to find what you're looking for customized living. So this say that a lot of times fast. This quick reference guide is a great starting point, and it's also got all the resources listed in it. And so whenever you click on one of them, you're going to see all of them, and that will help you know where to find, and they'll be available. And you can send this to the provider, and they will have everything that they need. They just need to spend some time going through it. So this quick reference guide gives you an overview, and I am not going to read to you. You guys can take time to do that. The lead agency or the county fiscal meeting is at 12 o'clock. So if you're a rates mentor, supervisor, we're going to go through them there as well. But you are all educated, smart people, so you can do this. You can get through this without me reading. Nobody likes to be read to. So this talks about service planning basics and how the tasks, and it really goes into plain language detail about the tasks, what they are, and how to think about them, and how to enter the time. And it says multiple times about not duplicating, and not counting available staff that are just there available, but not providing services directly to the person, which is, that's been a key, really, really hard piece of information for people that are really used to CRS, is to get kind of wrap our heads around. So, and then of course there's the limitations. So one thing that we thought would be helpful would be a nice table, because who doesn't love a table, between customized living and CRS settings, and kind of calling out some differences at a glance. And this will be useful for providers as well. We're hoping that instead of them hearing from you and, hearing, and maybe not believing what you're saying or arguing with you, this will help them have an understanding that there are serious differences, and maybe have a better understanding of the service that they're enrolled to provide, and that they've agreed that they know how to provide. So of course, on-site available staff is a no. It's something you do for CRS for sure. We've talked at length about available staffing. It's about individual tasks. The rates determined by staffing inputs, which can be shared. Of course, you all know that sounds like a CRS, doesn't it? It's not appropriate for customized living. The rates determined by the amount of time needed to complete each non-duplicative specific task. Of course, yes, for customized living. Time in the rate can be included when a person's asleep, No, there's a very rare caveat where if a person needs, an example would be if the person needs a task delivered to them when they're asleep, which is very rare, but an example would be if they need repositioning during the night. They're asleep, but you're still doing it, that you would count that time, but it's extremely rare. Typically, the inputs and for the tasks need to be when the person is involved and or awake. So service values include all supervision. Yes, those task service dollar amounts are inclusive. They include everything that goes into providing that task. Whereas CRS, the framework has different components to it. There's different percentages. There's different dollar amounts for each piece of the framework. So they're completely different. This service requires an assisted living license. Yep. For CRS, they would have a 245D license. So it's not the same license. There's different requirements. And the bottom one is the reverse, of course, requiring a 245D residential license. So this quick reference guide also addresses exceptions, which is rare that we would have information about the service and then also in the same place talk about exceptions. Usually we keep exception information separate. It's on the exceptions tab in the DWRS public page. But in this particular case, because we felt that all these tools needed to be together, and the information needed to be all in one place, we put some information here as well and the link to the lead agency provider tool. It is also still available on the exceptions page, just like it would be for any other lead agency provider tool, but it's here too. It talks about the rarity of customized living exceptions. Before the limitations went into place, we would get like 2 a year. And now we're seeing more of them, and every one of them seems to be an attempt to get around the 24 hours, which an exception that is not going to be used for that. And so here's some tips for you and the provider about, thinking about an exception for customized living. There's several things for you to think about. And then again, the additional resources, you can go to any one of those pages and continue on into the other documents. This is the, I'm gonna get, I don't want that there. Well, we're gonna leave it. So this is the old 6790H. So if you've been around a long time, then you know that document was around a long time. We share it with our aging friends. So we had a lot of work done across many areas to update this, to separate out aging versus CADI BI, to really point out those limitations. Again, this tool has a no wrong door approach to all the other tools. There is a table of contents in there, and it goes through each area. It talks about assess need, choice, service duplication, which is a biggie. It calls out CADI BI from elderly waiver because there are significant differences between the disability waivers and the elderly waiver. There is tons of information here that we encourage you to take note of. It's quite long. And then it goes into the specific tasks and kind of gives you an idea of what it covers, what it does not cover, or any additional notes that are important for you to know. And it goes all the way, and I'm sorry if scrolling, I did not know that scrolling made people feel nauseous, but apparently it does. So I'm sorry. I'm so sorry if that's happening right now. So anyway, it goes through. I'm not going to stop at every one. I want you to explore this. We also got some help from our friends in home care about nursing practices. So there's links to the nursing laws and the Nurses Act that are important if you need to know that. And then, like I say, it goes all the way through. And again, here's a bunch of additional tools, both for CADI BI and elderly waiver, AC, and of course, a lot of legal authorities, because that's pretty fun. Close your eyes now if you get nauseous, because we're going back to the top. So another thing we're gonna go look at is the new 6790G, which is super fun. So I know a lot of you have been waiting a lot of time for this to be updated. So this is beautiful. This is a smart form. So this is the actual, before you even get started, there's this cool instructions document on here that walks you through it. It also links you to the resources, and it gives you instructions. You and the provider wants to look at it to see what you're going to do. It walks you through it. It gives you tips, a few tips. It gives you some examples. So this is really neato. And then the actual
tool. See the document you're referencing.
What? I'm sorry,
we
what?
Can't see you view the document up, we can't see it.
You can't see it?
No, I think if you're just presenting your Internet Explorer there, it won't open up that file. It won't show it on your screen when you're presenting.
Really? Oh, because are you seeing the web page?
Yep. Yeah, if you switch windows, it should pop it up.
There you go.
There we go.
There we go. Yes, I know I'm sharing. Don't you love it when computers tell you the obvious? You're sharing two applications. Yes, thank you. So this is the new one. This is a live link now. It takes you to, the customized living page, the CBSM page. So there's really, it's a very smart tool. Provider name, same thing. The old tool has. Here's your licensure date. People wanted the housing with services licensure date, start date, the address, and then you're gonna scroll. This is a 2-page document, but it's a smart form. So this is how you add more services. You would select your main service, and then you will select your subservice, and you can build and build and build and build. And then after each area is a notes area. People wanted a notes area after each service, so that's been added, and then you can build and build. And then at the bottom, there's a final large notes area that allows you to provide any other, information the provider wants to provide you, but this is a great form for them. Okay, we're gonna leave this now and go back to all right. Oh. There we go. All right. So the one more is that I'm going to show you. The last one is the lead agency provider tool. Oh, I suppose you guys are going to tell me I'm also, oh no, am I still sharing now again? Can you see this?
I can see it.
Oh, goody. Okay, so this is the lead agency provider tool for DWRS exceptions for customized living. Again, it has links in it to get you to the other pages. So you are never without access to another page. And it's got the basic information. It's got the exception start date and the exception rate requested. So the total rate, just like now, and then each area and an unlimited amount of room. You need to save a version before having the provider fill this out. So advise the provider they should save a version so that this box expands, then it gets the slidey arrow thingy on the side if they save a version before filling it out. Save their own version, don't, try to save our version, of course. And then this is the total cost for that. Where is the extraordinary need? There's information in here, the rules apply, just like they do when you submit a regular exception. It's service-based. It is about the needs of the person. It is talking about what is it about the implementation of that task that costs the provider more. Describe the cost. Why does it cost more? And what is the cost right here? And then it goes on and has all your appropriate areas. That I'm going to stop sharing and we're going to go back to the PowerPoint. That's all right. And if you could bring back the PowerPoint.
Hey, Mom, could you make me presenter again? One minute, everybody. Or Jan, since you're still the presenter, can you click on my name and change that?
How do you want me to do that? Oh, you should go click and reclaim the host role. Click on participant and reclaim host role.
No, it would be change. You have to click my name and push change to presenter. It's on like the little 3 dots. Or Mong, are you there to change?
Get it. I did it. It's did it. I'm changing it back.
Got her.
Got her. Right click. It's a right clicker.
There we go.
There we go. All right. So we went through the documents. I'm hoping I'll be showing the same PowerPoint at the county fiscal, and then later today or tomorrow, I'll put the links in live so you have that, or get you all the e-list, which is even better. So again, there's a no wrong door approach, which should make finding your documents nice and easy. You can send the whole thing to the provider that you're working with and, let them go do some homework. And then, there you go. So next slide, please. Yep, we went over that. Again, it's also found. So again, I'll say you cannot use the exceptions to try to get around the 24. We've seen a lot of that. And exceptions for customized living should remain still very rare. It's a customizable service. You're purchasing specific tasks. And next slide, please. I pretty much said all of this. So, yep, if a person is assessed to need 2 to 1, then, and you agree as the lead agency that it's needed and it's documented in the support plan, it still needs to come within the 24-hour limit. Next slide, please. And then I believe we have some Q&A. So remember, if a provider is saying someone needs 2 to 1, they better be providing 2 to 1. It can't be used as a way just to get around and get dollars. And of course, you all know, everybody knows you can't authorize services that are not provided. And the SIRS team, and I, sometimes in conversations with me, I'll say SIRS and then I realize people don't know what that means, but that is the Surveillance and Integrity Review section. And they do ask us for rates information about people, and they ask for screenshots of staffing. So they are watching, they are looking to ensure that what is in the support plan and what is being provided is they match. So you really should assume that it's being reviewed, and providers are responsible for delivering services as always. That's not new, that comply with federal Medicaid and program requirements. We all know that. Next slide, please. Of course, your responsibility is for implementing statute and understanding the intent, scope, and limitation of the service, not authorizing something that is not appropriate, determining the assessed need, and of course, we are here to help you. That's what we're here for. Next slide, please. And then I believe we, just as a reminder, because these customized living sites are licensed by MDH, if they are threatening termination, there's, a specific process they have to go through. And so there are statutes and that address that, and the MDH website, which of course lists the acceptable reasons. And not being happy with the rate is not acceptable. That's not an acceptable reason for a termination. So of course, the issue that that we're seeing over and over and over is last year, $2,000 a day was authorized for 70 hours a day. And this year, implementing and discussing the actual needs of the person has brought that rate down significantly. And that's been a bone of contention, obviously, as it would be. Next slide, please. So I believe there are a couple questions in the Q&A, and can people, do we have to write answers, or can I just answer them verbally or acknowledge them if they're a comment?
Yeah, you can acknowledge verbally.
Okay, so Dan said we're experiencing the growth in customized living expenditures as there are so few placement options for very challenging individuals. The moratorium on CRS development, workforce shortage, and Costa counties for DNMC criteria has left case managers. We are well aware of that there is a systems issue that is in play, has been in play, where there are, not enough places. Unfortunately, it can't be resolved by using a service that's not appropriate for the intent as a way to go around that. And that's what we're trying to rein in. So Dan, DHS is very well aware of that. And there are very, that is a conversation that is being worked on, and not just conversations, but work that is being addressed throughout DHS. So I appreciate that. Danny, oh my gosh, I hope I'm saying your name right. For the case mix, minimum staffing hours, can you clarify in the manual page that 1 unit equals 1 hour? Yep. So if you go look on the rate management tool, it tells you what the unit is. It'll say hour. And they're either hour, day, or week or something. So yes, it says right in there what it is. And then when you enter, you're selecting, 5 hours a week or 1 hour a day, whatever is appropriate. So yes, you can tell by the 67G what the unit is. Available, hi Rosemary, available staff is your CRS, where there are 2 staff on there. And there are 4 people that live in the house, and those staff are there. That's what a CRS does. There's staff there available to help people. They're not doing a task every minute. They're available to help. That's a huge difference between CRS and customized living. Whereas customized living, you're not paying for that. You're paying for the implementation of a task. So I hope that helps. And then who provides the providers with this type of info? We are giving it, but who presents it to them? We anticipate that they, like you, will read through it, and if they have questions, they can reach out using the DSD contact form, like providers do when they have other questions related to WRS or other areas. So that it's the same as it is for other questions that we get. So if there is nothing else, I will hand it back. Thank you very much. This morning, I understand there are two under, well, I'm sure Corey, you'll talk about the other DSD update meetings.
Yes, I will. Thank you so much, Jan. Okay, now we are going to move on to our next presenter, and that is Gina with Moving Home Minnesota. So Gina, you can take it away.
My name is Gina Smith. I am the Aging Services Coordinator here for Moving Home Minnesota at DHS. And I'm actually here to get your feedback on some potential new services Moving Home Minnesota could be offering in the future. Next slide. Just quickly, in case any of you aren't familiar with what Moving Home Minnesota is, we are a federal Medicaid demonstration project. I feel like it's a very long-running demonstration project. I think DHS first launched the program back in 2013, and it's still been going. But the federal name for the program just nationally is Money Follows a Person. But here in Minnesota, we named it Moving Home Minnesota. And what our program does is it helps get individuals basically to transition them from institutional settings back out to the community. And with Moving Home Minnesota, they can access our Moving Home Minnesota services as well as waiver and state plan services to help with this transition. What Money Follows a Person does, Moving Home Minnesota, is that it lets states develop, basically implement and evaluate new services, HCBS services that might not currently be covered under the waivers or the state plan. Next slide. And then just to go over briefly what the eligibility requirements are for a program, if you're not familiar with that either. Individuals must be currently in a qualified institution. Qualified institution, this is defined as it could be a nursing facility, a hospital, including the community behavioral health hospitals, could be an ICFDD, could be a child and adolescent behavioral health service facility or CABS. It could be a PRTF, the psychiatric residential treatment facility. IMDs, if they're under 21 or over 65, or if the facility for any age, if they're participating in one of the 111 or 1115 substance use disorder system reform demonstration. They have to be in one of these qualified institutions for one or more. So it could be they've started a hospital, they went to a nursing home. As long as it's 60 days, 60 consecutive days or more, that's considered a qualified institutional stay. They have to be on medical assistance, at least prior to discharge, and maintain their MA enrollment in order to receive their Moving Home Minnesota services. They also need to have a completed assessment if it's in choices or the LTCC, confirming their institutional level of care ongoing for their community services. Then they have to transition to a qualified community residence. Now, qualified community residence could be their own home, owned or leased by an individual or their family. It could be their own apartment. It could be a community-based residential setting, which no more than 4 people reside, considered like a group home. Could be adult foster care. Assisted living can sometimes be a qualified residence, assuming they have their own space to sleep, eat, bathe, prep food, that kind of a thing. So that's what the eligibility requirements are for our program. Next slide. And as I mentioned, Moving Home Minnesota has a number of services it currently provides. What one people can get kind of depends on whether they're receiving waiver services or they're not receiving waiver services. If someone's using Moving Home Minnesota just by itself without a waiver service, they have access to basically all these services here on this slide. We cover transition planning and coordination and transition services. So kind of similar to RSC, relocation service coordination, and then transition services like under the waivers, we can help cover furnishings and supplies and deposits. We can also help cover the cost of like a case manager helping to look for housing or employment. We can do some environmental modifications, specialized supplies and equipment, PERS, gym membership fees. We have one, it's currently called home care training. It used to be known as post-discharge case consultation collaboration. It's also pre-discharge case consultation collaboration. So if you needed a maybe a professional to consult, maybe if someone had like an eating disorder or something, and you want a professional to be able to consult to kind of help come up with the best plan for them to, safely move to the community and stay there. This kind of covers that, that consultation with professionals to kind of help make sure that someone's surrounded, with the best supports they have. They can also have a case manager to kind of manage their services. And this whole presentation is going to be out on the DHS website. So if you get our presentation, you can click on that link down the bottom saying our MHM services table. And I'll give you more details about the rates and limits and when they can and can't be used. If someone's on a waiver, if a service is considered a duplicate, like environmental mods, Moving Home Minnesota covers environmental mods, the waiver covers environmental mods, that's considered a duplicative service. So they wouldn't be able to get that service under our program. And so I hope that clears up a little bit about how our program works with some of these waivers and state plan services. Next slide. And this is where I wanted to reach out to you and get your feedback. At the end of March, CMS, the Centers for Medicare and Medicaid Services, sent out a letter to all of the Money Follows the Person states, where they are going to be expanding the supplemental services we can offer under our program. These supplemental services are supposed to help address those barriers to transition, whether it's a lack of affordable housing or it's food issues or administrative or financial barriers. So we're able to provide some new supplemental services to kind of help address these issues. Next slide. So under these expanded supplemental services, they would be able to cover, our programs will be able to cover up short-term housing assistance, so up to 6 months of short-term rental assistance and utility expenses to kind of bridge a gap. So maybe it takes some time for someone to get their paperwork in order to get housing assistance. This could be like, again, kind of like to be able to fill that gap and cover the rent until they can get everything up and running. We could also cover food pantry stocking for up to 30 days. We could cover some pre-transition activities, like covering payments for home mods, vehicle adaptations, pre-tenancy supports, transition services. We've heard, I think from counties in the past that, for example, like home mods, that is something available under the waivers. But sometimes there have been providers maybe where they don't feel comfortable, maybe starting the work when they have to wait until the waivers open to get reimbursed. So this Moving Home Minnesota could potentially maybe cover portions of deposit or portions of expenses like up front before the waivers actually open. So that could potentially be, a really unique way to use our service. And then again, we could also cover like apartment fees, application fees. If you're applying for an apartment, oftentimes there's a fee, associated with that. Next slide. But then in addition to just those services I went through with you, CMS also said, states can propose their own services. And so our team got together and did brainstorming just based on feedback we've heard from over the years with our transition coordinators and from lead agencies about different ideas, we could potentially provide as a new supplemental service. And again, this is just thinking very big, very broad, just trying to put everything under the sun together into a list. And so we thought of, again, some of the existing things like deposits. Maybe we could do like an enhanced deposit if someone has a criminal background or other issues. They need to kind of provide an incentive for a landlord to take them. Perhaps like record expungement costs, maybe record collection fees. A lot of times we'll need medical records or driver's licenses or IDs in order to get maybe SMRTed or something like that to have a whatever cost fees, maybe like guardianship, rep payee, moving expenses, movers to pack someone, help them move. I probably won't read through every single one of these, but fan or air conditioning. We could cover other small appliances, maybe caregiver, family supports, financial counseling or coaching to kind of help them with their finances or medical assistance eligibility. Perhaps access to culturally specific foods, if they're going, if they're going to assisted living or something, and you're just getting chicken breasts and salmon. It's not something they're maybe used to eating in order to keep their appetite up. Maybe give them some more culture appropriate foods or culture appropriate items like smudgings or blessings. A flex fund maybe. Sometimes it's just you find moving expenses that you weren't really expecting, and then maybe we could just have a flex fund to kind of address those. maybe dumpsters if someone was a hoarder, trying to help clean someone's house in order to get that set up. So this is where I then wanted to tap into your minds. Again, thinking about, what we listed, thinking about, yourself, the people you serve. Again, Moving Home Minnesota, as long as they come from a qualified institution and go to a qualified residence and maintain MA, it could be someone where it's a pretty easy move. They're going from a nursing home to an assisted living and it's pretty much furnished. Maybe it's someone that's homeless and we're finding a home for them for the first time. We run the gamut, of what someone may need. So thinking about this, what services not listed here, did we not think of? Think about, like what have the waivers maybe not covered in the past? Like, hey, if we had the waiver cover this, we could have helped someone, but it doesn't. What's a service that Moving Home Minnesota could provide, a supplemental service? Again, thinking in mind, supplemental services are one-time, short-term, so it can only be on Moving Home Minnesota for a year. So it's something that we can't cover, long term, for multiple years. But if you want to go to the Q&A and submit those ideas, and I can give you like a minute or two to think about it and get those submitted into Q&A. We'd like to hear from you as to what ideas for new services we could provide.
As a reminder, the Q&A is located on the bottom right hand of your screen. If you would want to submit that through your Q&A, we had some technical difficulties and couldn't get a poll working. So if you could send that through, we would greatly appreciate it. Maybe just say the question one more time, Gina, just to make sure everybody was tuning in.
Yeah. So in the chat, I would like you guys to just provide any ideas you have for supplemental services that maybe we didn't cover already. Is there something, the waivers currently aren't covering that you would like us to see? Is there some need that, we haven't addressed that you'd like to see, covered under this program? I haven't seen a suggestion for remote monitoring for equipment, cameras for tracking, devices or apps, assessment, installation, troubleshooting. See here, bicycle that's not modified, if that is the preferred method of transportation, most cost effective. Thank you. All right, services on the site would be so helpful. What about the cost of a service animal? Thank you. How about veterinarian fees and vaccinations, etc.? Thank you. Give another minute or two for you to think of any other ideas you have. All right, companion type supports. Can this be a family member? I think that certainly is possible to have companion supports or something like that. Thank you. All right, and then I have a second question for you. Now we've kind of looked at, all the different ideas and thrown some ideas out in the chat as well. Obviously, CMS as well as DHS probably is going to have the capacity to, implement 30 something services. I'm sure you can imagine like that would be a little overwhelming. Are there certain services you think we should prioritize? So if we need to, cut this package down to, several services, obviously all these would be wonderful. In a perfect world, I'd love to, implement all these, all at once. But what ones would you like to see at least DHS make a priority to kind of push through to get added as a new supplemental service? So suggestion for court fees for guardianship or conservatorship. Yeah, so again, think it over, type into the chat, the Q&A again. What services would you like DHS to prioritize as we move forward? Rental assistance, thank you. Guardianship rep payee fees, thank you. Moving expenses and movers, thank you. Priority services, moving costs, dumpsters, let's see here, rental assistance and deposits. Yeah, and I'd suggest phones and computers, internet service, service animals, small appliances, companion type supports, pantry stocking, culture appropriate foods, items and activities. Thank you. Give another minute or two if there's any other services that you think we should prioritize. Yeah, I agree with a lot of the suggestions, moving expenses and pet expenses. Thank you. I see rental assistance, utilities, including internet, guardianship rep pay fees, moving expenses, dumpster cleaning, flex funds for non-MA. The flex funds for non-MA covered items unknown. So your rental assistance, utilities, including internet, guardianship rep pay fees, moving expenses, dumpsters cleaning, let's see here. Flex funds for non-MA, yeah. All right, well, thank you for that feedback. If you want to move to the next slide. And we just have our thank you out here. I have my personal email address as well as the Moving Home Minnesota general address. So if you have other ideas for what you want us to prioritize, or even just ideas for new supplemental services, feel free to send those either to me or our team email address. We're happy to take your suggestions.
Thank you, Gina, so much. We greatly appreciate it. And all that information. If you guys have any, we thought we might have a couple questions. Let me scroll up here real quick to see if it's something we can answer offhand here. Does Moving Home Minnesota cover clients who only have Rule 185 case management services?
They would have to have, medical assistance, but, if they're not having other forms of like case management or something like that, that is fine.
Thank you. And I think we had one more. If someone is living in,
go ahead.
Sorry, go ahead.
Oh, go ahead, Corey.
If someone is living in an ICF-DD facility, wouldn't they have a DD case manager who would be responsible for finding the next place to live, therefore not eligible for RSC or Moving Home Minnesota?
If they're in an
I'm not sure if they're-
ICFD, yeah, if they're in an ICFDD, they can certainly use Moving Home Minnesota in order to help them with the transition. If they're going to be going on a DD waiver, they would obviously have a DD waiver case manager to kind of coordinate, their waiver case management services. But, before they're on a waiver, they would then have Moving Home Minnesota to kind of help do that, work with the transition piece of it.
This is Shannon, and I just want to clarify a piece of that might be in here but not written in the questions. A lot of times when somebody is receiving Rule 185 case management, that is paid for adults through VADD targeted case management. So maybe part of the question is, can a person receive VADD targeted case management and Moving Home Minnesota at the same time?
Sure. Yeah, I will have to double check on that. Like, I believe Rule 185 was not a conflict on that, but I can double check and get back.
Thank you.
And I see there was a question that came from Melissa that's saying, I was not aware you could have Moving Home Minnesota and the waiver at the same time. You can. Yes, someone can have Moving Home Minnesota and the waiver. Just so I kind of mentioned, the limitations currently with the program is that if there's a service going to consider like a duplicate, so example for like home mods or transitional services, if they can get it under the waiver and they can get it under Moving Home Minnesota, they have to take the waiver version of that service, which kind of pares down our service menu quite a bit as to what someone can get when they're on a waiver and Moving Home Minnesota at the same time. But yes, they absolutely can have those programs overlap. Like I said, there's just more of a limitation as far as the duplication of services goes.
That is the only questions I am seeing on my end. Yeah, so if anything else comes in, we'll let you know, Gina. Otherwise, thank you so much. We appreciate your time.
Perfect, thank you.
And on that note, we are going to switch over to our DHS announcements, where Emily Miller is going to take us away.
Hello, everybody. Hope you guys can all hear me well. I've never been accused of being quiet, let me tell you. So here we are, August. What the heck, guys? That summer just flew, but we're glad that you're here, and we'll get going here. So, DHS announcements. Let's start off here with some legislative changes. Although we did, have our friend Charles who gave a great overview. I think Charles actually hit on this, but just one more time. We want to send out that reminder that when legislative changes are made, DHS is given the authority and responsibility for development and implementation of that change. So many changes take thoughtful preparation and can include then that federal approval, getting the system changes, and those systems are MMIS, SSIS, MnChoices. And then we have process and implementation guidance for lead agencies that we have to publish. So again, we say it like a broken record, but please get on the DSD e-list announcements. I mean, that's your hot spot, guys, to get the information. That's really going to be the communication river to tell you when changes become effective. Next slide, please. All right, I guess I need the next slide myself. Sorry about that. Okay, status of the MnChoices revision project. So as it was announced, the MnChoices revision will not launch before the end of the year. So we will provide an update for our progress by September 16th of this year. Now, since that last status update, DHS has amended and extended the contract with FEI, which allows us to continue our work to set a launch date for the MnChoices revision project. Launch date, not lunch date. What's on my mind, huh? All right, we also hired a MnChoices contract and operations manager, which is a newly established position that will serve as the liaison with the vendor, DHS, and Minute leadership, and internal subject matter experts for continuous improvement and contract management. We also added additional micro-learning training videos on how to use key features of the system to help to also access the Help Center and the revised MnChoices application. Now, for questions about the MnChoices revision project, Notice the email on your slide there, the dhs.minchoices@state.mn.us. Next slide, please. All right, the 121-day progress. So the 2021 legislature adopted a provision to allow people who temporarily enter certain settings for 121 or fewer days to return to the community with the same waiver or AC program without a reassessment. So DHS has been working in phases to fully implement this policy. Now, the first phase of the policy was implemented back on May 16th, and that allows for a person's waiver or AC to remain open for 30 days after admission to certain settings that prior to the COVID-19 requirements required closure upon admission. The e-list with more information can be found on that link where it says here. Now, the second phase of implementation is currently underway. It involves creating an MMIS administrative option to return a person to their previous program without assessment if discharged within 121 days of admission to the setting. So we're in the process of making the final changes to MMIS and then updating the policy and the MMIS manuals. So we're going to communicate more information via e-list. One more time, get registered for the e-list when the implementation date is known, okay? Now, it's important to note that during the COVID-19 public health emergency, lead agencies are prohibited from terminating a person's participation in all medical assistance funded home and community-based service waiver programs. So you still must continue to follow the temporary COVID-19 policy until further notice from DHS. So as a reminder, during the COVID-19 national public health emergency, because we're only under the federal public health emergency, a person's HCBS eligibility may end only if they move out of state, they're deceased, they leave a program by choice, or they're admitted to certain institutions for 30 days or longer. So again, this applies to AC, EW, BI, CADI, CAC, and DD waivers. Next screen, please. Next screen, next slide. All right, remote reassessment update. So again, with the 2022 legislative session, it resulted in changes to the Minnesota Statute 256B.0911, Subdivision 3A-R, which outlines the requirements regarding remote reassessment. So the statute lays out the following requirements that are on the slide. Remote reassessments conducted by interactive video or telephone may substitute for in-person reassessment. For services provided by the CAC, CADI, BI, and DD waivers, remote reassessments may be substituted for 2 consecutive reassessments if followed by an in-person reassessment. And for services provided by AC, ECS, and EW, remote reassessments may be substituted for 1 reassessment if followed by an in-person reassessment. All right, so there is that. Next slide, please. Okay, remote reassessment update. We're going to keep going with it. It's permitted only if the person being reassessed or the person's legal representative, if there is one, consents for a remote reassessment after being provided informed choice by the lead agency. Now, lead agencies must document that informed choice was given. Also, the person being reassessed or the person's legal representative has the right to refuse a remote reassessment at any time and then have an in-person reassessment instead. During a remote reassessment, if the certified assessor determines an in-person reassessment is necessary to complete the assessment, then the lead agency shall schedule an in-person reassessment. All other requirements of an in-person reassessment shall apply to a remote reassessment, including updates to the person's support plan. So now during the federal public health emergency, DHS has allowed lead agencies to conduct phone or video visits in place of in-person visits for people who seek or receive HCBS services and supports, or people with developmental disabilities who need an OBRA Level 2 evaluation. Assessments, reassessments, and case management visits can continue to be remote until up to 6 months after that federal public health emergency ends. So when DHS notifies lead agencies that the COVID-19 policy changes that they've ended, which we haven't yet, but when that time comes, lead agencies will then follow the new posted COVID-19 policy regarding remote reassessment. So DHS will communicate, of course, more as that new policy will have to take place. So when there's an end date in place for that public health emergency, we'll be on the horn with you. All right, next slide, please. Okay, SMRT update. So SMRT's Integrated Service Delivery System, or for short, one more acronym here, ISDS, has a read-only access role in the system. So this role will now be available to county min-choice assessors and other county social workers, including staff within economic assistance or your income eligibility workers. This will allow county staff to review the SMRT status within the state system. So stay tuned, more communication coming on that. I'm gonna guess it's gonna be on an E-list. All right, next slide, the regional variance factor. So beginning back on July 1st this year, we began using that updated regional variance factors in the disability waiver rate system frameworks that was required by Minnesota legislature. The system will begin to use the new values for services with a start date of July 1st, 2022, or later on a rolling basis as service authorizations either renew or change. To view the regions and the regional variance factors, you want to see that link on your screen there, the 2022 DWRS Regional Variance Factor webpage. And then, of course, there is the May 19th E-list link there as well. Next slide, please. Okay, the My Move plan. So DHS will publish, now they published a revised version of the My Move plan. You see the link there on August 1st. So lead agency staff and contracted case managers should have started using that new version that was published on August 1st. The previous version will no longer be available now. DHS conducted statewide focus groups in response to continued feedback in order to develop the change recommendations that are reflected in this new version. So it will promote a more personalized planning experience for people who need services and support. Additionally, it will reduce duplication of the support plan and align with requirements based on the person's specific needs. When a person moves from one residence to another and does not intend to return, their case manager or care coordinator must work with the person to complete that My Move plan summary. DHS also created a training on how to best support a person's move, and it's titled Supporting My Move, a Case Manager's Role. It's an online, on-demand course for disability waiver case managers to guide them through their role and responsibility in supporting a person to find a new home. So that's available on TrainLink. Next slide, please. Okay, legislative change about grievance policy. So effective back on July 1st of this year, counties must provide people with contact information to file a grievance with the county about the quality of their contracted case management services. This requirement applies to people with developmental disabilities who receive contracted case management services and access a home and community-based services waiver, Rule 185 case management, or developmental disability targeted case management. To ensure that this new requirement is met, we recommend counties provide grievance contact information to all people who receive waiver case management, Rule 185 case management, and developmental disability targeted case management. DHS is working to update our policy manuals to reflect that change. Now, for questions about the disability services, please use that DSD contact form. And for questions about aging services, we would like you to use their email, which is dhs.aasd.hcbs@state.mn.us. Next slide, please. All right, individual case manager. So we are wanting to clarify policy regarding assignment of a case manager to a person who receives waiver services. So DHS policy staff have recently received questions about using a team approach to case management rather than assigning a person as an individual waiver case manager. According to state statute and Minnesota's federally approved waiver plans, including the 1915B case management waiver, a person who receives waiver services or Rule 185 case management must be assigned an individual case manager. Now, DHS encourages the use of lead agency. Hold on one second here, I'm just having, there we go. Sorry about that. So we encourage the use of lead agency or contracted agency support, such as temporary and time-limited coverage, peer consultation, and case aid. However, the person must receive their case manager's name and their contact information and be able to contact them directly. So if a lead agency or a contracted case management provider is using a team approach to providing case management, it must remediate the situation immediately by ensuring that each person does have an individually assigned case manager and that each person is informed of who their assigned case manager is and provides a means to contact their assigned case manager directly. State policy staff are available for consultation for this and to ensure workforce shortage solutions are allowable. The contact information for consultation is available in that e-list linked here on the slide. All right, next slide, please. CFSS update. So we do plan to launch the CFSS on or after November 1st of this year. Now, this flexible health care program will replace Personal Care Assistance, or PCA, and the Consumer Support Grant, CSG. When the federal government approves CFSS, DHS will provide the information about the transition plans and the time frame. Counties, tribal nations, and managed care organizations will transition people at their yearly reassessment to ensure that there is no disruption of services. As the start of CFSS approaches, DHS will communicate with people who use and provide PCA and CSG services, lead agencies, and other interested parties as well. Next slide, please. All right, the CAT-CADDY-BI waiver amendment approval. So the Federal Centers for Medicare and Medicaid Services, or CMS, approved DHS's waiver amendment package on June 15th of this year. Now that amendment package affects the following waivers: brain injury, CADDY, and CAC waivers. DHS has not implemented the changes in this e-list yet. To implement these approved changes for BI, CAC, and CADDY, we must update our policy manuals as well as MMIS. We will send e-list announcements and update the CBSM What's New page when those changes are implemented. Now, additionally, CMS has not approved the DD waiver renewal yet. We will also send out an e-list announcement once we get that approval for the DD waiver. So please review the summary of changes included in this waiver amendment package in the e-list linked on the bottom of the slide. All right, the decision tool to compare EIDBI and special education services. So DHS and the Minnesota Department of Education created the link here, EIDBI Service Decision Tool, the 6751U, to help people with autism spectrum disorder and their families decide what combination of EIDBI and or special education services may be a good fit. Services and supports offered by the medical system and the public school district are not always a one-size-fits-all. So they should be chosen to meet the needs of each child and their family. Parents and caregivers can use the EIDBI service decision tool to decide when to use the state EIDBI benefit or services and supports through a public school special education program or a combination of both. The decision tool is most useful when reviewing the results of the clinical evaluations, the educational evaluations, and the referrals or recommendations from the child's care team. You can also review the EIDBI manual, Comparison of Special Education Services and EIDBI, for an in-depth comparison, including information for evaluation for eligibility and how to access the service. Additionally, that page includes resources such as the Minnesota Autism Resource Portal that provides information about a variety of service and support options. Next slide, please. Okay, additional exception to corporate foster care moratorium. So this slide is in reference to what Ms. Jan Buck already covered earlier in her presentation, but we wanted to share the e-list and the CDSM page just to highlight all the required criteria for this moratorium exception. Now this exception is only available until June 30th of next year, 2023. All right. Next slide, please. The CDCS Enhanced Budget CDSM update. So we did update the CDCS policy manual, the enhanced budget link here that you'll see. And when you click on that, you're going to get information on how it would reflect the change in the eligibility for the enhanced budget from 12 hours per day of PCA to 10 hours per day. Now that went into effect January 1st of this year for people on the BI, CAT, CADI, and DD waivers, and July 1st of this year for people on AC and EW waivers. It added instructions on how to complete that DHS 6633B, and it updated instructions for reassessment. Now, additionally, the CDCS Enhanced Budget Request and Community Support Plan Addendum was also updated to reflect those changes. All right, next slide. The emergency staffing pool has been around now for a while during COVID-19, but at DSD and Adult and Aging Services and the Minnesota Department of Health are working together to provide temporary staffing options for eligible providers. So if you or the providers you work with have questions about that application process, please review the information provided here on the links on the slide. Due to the volume of the requests and the availability of emergency staff, we are only approving provider applications that are experiencing a COVID-19 outbreak and a severe staffing crisis. Organizations that receive assistance will get help from temporary staff members for up to 21 days, and that is of no cost. Okay, an assistive technology e-list to recap here. So we want to review this last quarter's technology e-list that provide information and resources related to assistive technology. So in May, DHS discussed how technology may be able to reduce the effects of staffing shortages. It reviews why you should plan for staffing shortages now, and this will be how to help people transition to technology supports, as well as how to support ongoing use of technology and tips to help people build those necessary skills in using technology. So in our July Part 1 e-list, DHS encourages lead agencies to check out the webinars that are available through the Minnesota Network and Education for Assistive Technology. We also call that MNMEET. They cover a variety of topics, such as technology to aid people in the transition age, modifications to make the home more accessible, and ways to pay for assistive technology. So please visit that Minnesota NEAT technology website to learn about the information and the webinars they offer. So to wrap up our quarterly technology updates in our Part 2 July e-list, we shared resources to help people gain access to assistive technology services and information that is accessible as well as culturally appropriate. So to review all of these technology e-lists from earlier in the year, please visit the DSD Archive e-list page. To learn more about assistive technology, please visit the Minnesota Guide to Assistive Technology resource linked on this slide. All right, I think that does it for me. Thank you, everybody, and I will hand off to my coworker, Chad Erdman. Have a good day.
Thank you, Emily. Good morning, everybody. My name is Chad Erdman. I am the RS for Upper Northwest portion of Minnesota, so Regions 1, 2, and 4. And I will be reviewing the COVID-19 updates and resources section, upcoming training sessions and webinars, slides, and ending with the resources section. So the federal public emergency renewal. On July 15th, 2022, the federal COVID public emergency was extended. You can review the official renewal announcement on this slide. The federal government will provide us with a 60-day notice prior to ending the public health emergency. COVID waivers. These COVID waivers are attached to the U.S. Department of Health and Human Services COVID-19 public health emergency. Once the public health emergency ends, Minnesota has federal waiver plan authority to end the following COVID waivers no later than 6 months after the end of the federal public health emergency. These include the CV-15, which allows phone or video visits for waiver programs, the CV-43, which is the expanding remote of home and community-based waiver services for people with disabilities, the CV-44, which allows remote service delivery of adult day services. Because the federal public health emergency has not ended yet, end dates for these COVID waivers have not been determined. Each of the linked web pages will be updated, and the modified timeline with the end dates will be included. The following waiver will end the last day of the month with the federal public health emergency ends, the CV-17, the maintenance of efforts and continuing eligibility. And at the end of the public health emergency, the following waivers will end: temporary allowance for parents of minors and spouses to be workers. Now we'll be reviewing some upcoming trainings and webinars. DSD in the Aging Division has a webinar series called Building Your Skills, Developing a Support Plan. These services will be available on the last Wednesday of each month from 10 a.m. to 11:30 a.m. This webinar series will focus on foundation knowledge of support planning skills. Each month's agenda will include the most up-to-date information and resources about support planning from the DHS Aging and Adult Division and the Disability Service Division. Going forward, we'll be using these meetings to propose topics and gather questions in order to create online, self-paced support planning training modules. You can register via Train Link for the whole series this year, and the link to Train Link is on the slide. We want everyone to be aware of the Relocation Services Coordination and Moving Home Minnesota Community of Practice. We invite lead agencies to be involved in this community of practice and to share the information with RSC and Moving Home Minnesota providers in your area. The remaining 2022 meeting dates are scheduled for August 25th and November 17th. The full RSC Moving Home COP, which includes both lead agencies and providers, meet from 2 to 3:30, and the lead agencies have a separate community of practice following the joint one from 3:30 to 4 o'clock. If you're interested in joining this community of practice, please send us your request, including your name, email, and lead agency through the DSD contact form, which is 8168. I wanted you to be aware of some autism training opportunities. Please visit the Minnesota Autism portal to view a variety of resources such as on-demand trainings, live trainings, and events, and information for each person and their families. There's some online self-paced trainings. We just want to make sure that you're aware of these online trainings. They are available through TrainLink. We highly suggest bookmarking the DSD training news and information page. This is where you will find the latest trainings and webinars offered through our division. You will also find a link to the DSD training archive page that lists all DSD past trainings and handouts. This next section will provide you with helpful resources that we suggest you bookmark. These are the usual suspects that we normally alert everyone to. The next two slides will be providing you with some resources related to the workforce shortage. We acknowledge the barriers and hardships the workforce shortage is causing. We want to remind you that DSD has a website that contains information and resources related to the direct care workforce shortage. It provides information such as state-sponsored work groups and provider resources. We encourage you to take a look at this page to keep updated regarding current efforts to address the workforce shortage. Here are the links to additional resources regarding workforce shortage that we have discussed in previous DSD updates. EVV, information and resources. Please review the resources on this slide to keep updated with the progress of EVV. Earlier this year, DSD launched a new contact form from the Disability Services Division. The DSD contact form provides a consistent way for people to submit questions and get technical assistance for DSD topics. This is the 8168 that I was referring to earlier. Last but not least, here are some of our foundational resources for communication and policy references for DHS. Thank you for joining us today. If you have additional questions about the information contained in this presentation, please submit them using the DSD contact form. Thanks again. Enjoy the rest of the summer, and I will return it back to Corey to see if there's any thing that needs to be wrapped up.
That's all we have for you guys today. We appreciate your time, and if we didn't get to your questions in the Q&A, we will attempt to reach out to you with those answers after we get some more policy guidance on them. So once again, thank you and enjoy the rest of your day.